Hi, guys. Good morning. Welcome to Neighborhood Nurse NCLEX Review. Today, we're going to start with our first series for mental health nursing. If you know, mental health nursing is a big part of the NCLEX Review. So, I'm going to be starting a series of topics on mental health, and we're also going to have time where we review NCLEX questions on mental health. So today our first topic would be anxiety disorder. What we're going to be doing in anxiety disorder will be definition of anxiety, types of anxiety, levels of anxiety, nursing interventions, priority nursing interventions, and like I said before, endless questions and rationales for mental health nursing. Okay, so let's get right into it. What is anxiety? So basically, most of the contents we're going to be using in this review will be Sanders. So according to Sanders, anxiety is normal response to stress. Anxiety is subjective experience, which means it's the person that is experiencing it that tells you how they feel, the symptoms and the signs they are feeling at that time. And the patient in question can be experiencing apprehension, uneasiness, uncertainty, or dread feeling. There are various types of anxiety. There's normal anxiety, which is very healthy. Every human being has an anxiety episode or has an episode where they feel anxious about something. Acute anxiety, changes that threaten one's security. Chronic anxiety, this is where the problem now sets in. Persistence and its typical response to daily activities. So basically, daily activities make the patient feel anxious. So this is where the problem starts. When this anxiety occurs as a result of threats or which can be perceived or misinterpreted. Okay. Now let's talk about the levels of anxiety, the physical symptoms, and what we can do about it. So mild anxiety can be caused by intense experience that occurs daily. It increases, this is actually good because it increases information grabbing, sense of sight, perceptual field. It can motivate the individual and help them grow and increase their learning. They feel several symptoms, but the basic ones they feel is restlessness, irritability, and mild tremor. Whereas in moderate anxiety, unlike mild, they have narrowed perceptual field, reduced sense of sight, sound, and selective attentiveness. Here, the patient will start feeling changes in vital signs like increased heart rate, sweating, gastric discomfort, urinary urgency, mild comfort. Now, note, wherever you see me highlight a sentence in red, it means it's something you need to know for the NCLEX. Okay, so learning and problem solving still occurs during moderate anxiety. The patient here can still learn and solve problem during the time they are facing moderate anxiety. Now, what do we do for patients that are experiencing mild and moderate anxiety? We help the patient identify the source of that anxiety. We get to the root cause. What is causing this anxiety? What action or what event precipitated this? What caused it in the first place? We talk about the feelings and their concerns, what prompted this anxiety, like I said before, and how we can solve this problem. And we can also encourage the patient to have gross motor activity like exercise to help reduce mild or moderate anxiety. Now we're going to the ones that are the ones that require attention. It's severe and panic attack. So in severe anxiety, uh, they sometimes feel bad when things happen, and they have significantly narrowed perceptual field. They have reduced focus, scattered details, and we start looking for behaviors that help them curtail this or help them reduce anxiety. Now, the physical symptoms they can be feeling will be caused by the physical symptoms they'll be feeling would be headache, nausea, dizziness, sleep disturbance, increased tremor, heart pounding, and hyperventilation. Again, an NCLEX note for severe anxiety. The individual needs direction to focus. As you can see in the physical symptoms, here they have scattered attention to details and reduced focus. So the nursing intervention here would be for us as nurses to help this individual narrow down and direct their focus. Now let's move to panic attack. Panic attack is usually associated with dread and feeling of impending doom. Take note of that word, impending doom. When you see that word, you should know we're talking about panic attack. Here, the patient is disorganized, difficulty perceiving reality, inability to concentrate, or loss of rational thoughts. They can think properly now. They have disturbed perception, and they are unable to communicate effectively. Not just communicating, they can't even function effectively. Okay, so they have increased motor activity, such as pacing around, shouting, screaming, withdrawing, erratic behavior like trying to be overly sexual. This is in panic attack. This is where you see this kind of things. Now let's note what we need to remember for NCLEX in panic attack is they have prolonged exhaustion that can lead to death. Panic attack is not something to joke about, it's something very serious. Here the patient needs attention. They need attention to help them reduce exhaustion that can eventually lead to death. The first part, minimize, okay? Decrease environmental stimuli and stay with the client for safety reasons. Safety is very important. If you know anything about the NCLEX is a safety exam, okay? Ask the client to identify what and how he or she feels. Encourage the client to describe and discuss how or he's feeling. Help the client identify the cause of the feeling. What prompted this kind of attack or what prompted this anxiety? Okay, listen to the clients for expression and hopelessness. Okay, document the event. Documenting is the last thing we do in terms of intervention. Significant information, follow-up, action, and client response after we have administered the care to them. Okay, so in our next class, we'll be looking at anxiety. We'll be like questions on NCLEX questions on anxiety and general anxiety. So guys, stay tuned for this series. At the end of this series, we would have several NCLEX questions and rationales and what we need to be looking out for in terms of mental health nursing questions in your NCLEX exam. So please guys, don't forget to like, subscribe, share, and send this video to your friends. This would help us get more visibility on YouTube and other channels. Thank you so much for listening to the end of this video. I'll see you in the next class. Bye.